The Gina and Maddie podcast.
Oh my God, I'm so excited. So Dr. Shauna is in the house, and I'm a big fan for a start because I listen to your podcast. Welcome.
Thank you so much. I'm so happy to be here.
Before you launch in, I just do need to apologise. If the studio smells like meat, it's because we had pies for breakfast and that was my fault. I pressured the girls into having pies for breakfast. So if there is an odour in here, that's what that is. It's not how we normally smell. Okay?
You were just trying to get the protein up for Gina here, were you?
There you go.
Exactly what I was doing,
I thought you were going to apologise for the way you introduced this was coming.
No, I was going to just move right along from that.
Yeah. So, Dr. Shauna, I've started to just talk about on the radio only yesterday about what I'm going through. I'm hot and cranky and tired and aching and this very long list of symptoms that a lot of my girlfriends are going through as well. And you very kindly yesterday rang in and I put you on the spot and said, can you come in? One of my friends was listening and he went, oh my God, you just put that doctor on the spot and made her come in the next day. I'm so sorry. Just to shimmy and drop everything for us.
No, that's all right. It's a pleasure to be here. And thank you for talking about this because it's so important that we break down the taboo.
Yes, because when my mum went through this, nobody talked about it. And even I think potentially a generation, not even a generation, like 10 years younger than me, maybe weren't talking about it at all. And it shouldn't be embarrassing. And I listened to one of your podcasts where you were saying some women just want to put up with it. But why should we? We need to work out how to fix it.
Absolutely. We want to just thrive and not just survive.
Yes.
You know, it doesn't need to be horrendous. And I think for a long time culturally, women have kind of been told to fade into the background. And I think that at this time of life, you know, look at Forbes now have a 50 over 50 list.
Yeah.
You know, women at this age are really beginning to take the stage and know who they are. And we don't want to be feeling like we can't get to sleep at night.
No.
We don't want to be feeling lethargic and exhausted and cranky with everybody. We want to be living our best lives.
Absolutely.
And we can.
Dr. Shauna, what is menopause? Like, I know that's a pretty broad statement, but for me sitting over here, my idea and what I know of menopause is women stop having their period and, like Gina said, you get a bit hot and a bit cranky. But what is menopause?
Okay, so funny thing, menopause is actually one day in your life, okay? So menopause is officially one day, 12 months after you've had your last period. And everything after that is the postmenopause, which goes on until the day you die. And before that, there's a period of time called the perimenopause, which is the lead up to the menopause. And they call that the zone of chaos. And the reason that we have lots of symptoms is that the hormone levels are literally on a bit of a roller coaster. So whenever you're younger, hormones kind of rise and fall in a really predictable and kind of gentle way. Well, for most women. For some women before their periods, they're pretty cranky and don't feel great. But it's often a very predictable journey. When we're in perimenopause, hormones can be high one day, really, really low the next day, 2 days later, peaking again. And so the only thing that's really consistent is the inconsistency of how you feel. So that perimenopausal period is really tricky. Now, that definition of menopause is actually quite challenging because if you're a woman who's had, for example, a hysterectomy and you don't have periods, or you've got polycystic ovaries and you don't have periods, or you maybe have a Mirena contraceptive device and you don't have periods, well, then when is that last period? It's a very tricky definition, and it's definitely a definition that leaves a lot of women wanting as to how they know when it is. And the other really tricky thing is that there's no blood test to diagnose the perimenopause. So lots of women will present to their doctor and be complaining of feeling exhausted or not being able to sleep, or maybe having hip pain or, joint pain, or maybe they're complaining that their mouth's really dry or their skin's really itchy or their eyes are dry. Like the symptoms are quite varied, and sometimes women think they're going insane. And of course, even as a doctor, you can end up going down a completely wrong trajectory, thinking you're investigating joint pain, which of course you are, but actually you need to be thinking, could this actually be perimenopause? And the real problem as a doctor is there's not a simple test to say this is the perimenopause, because when you do someone's bloods in the perimenopause, they look normal.
Oh, really? Because I was just going to ask, how do you know when perimenopause is coming? Because what sort of age is it roughly? Or is there an answer to that?
So what I would say is that, in sort of white Anglo-Saxon people, the average age of menopause is 51. But obviously Australia is a bit of a melting pot. We know that Asian cultures often have an earlier menopause. But on average, you can have a perimenopause that goes on from anything from 2 to 10 years before that.
Why?
Joy.
Why, if 50% or 51% of the population are going to go through this, why is it something that is only being spoken about now, and if that, and has it been kept behind a curtain when for years you talk about men aging and they can very easily go and get themselves little blue pills that'll help them do things and, you know, that kind of stuff? Why is menopause still a bit of a taboo in the public forum?
Look, I think for a lot of reasons. I have a bit of a theory on why it's become very popularized recently. Is I actually think that you've had the maturation of a lot of female doctors. So if you look at the people who are really pushing this space, a lot of them are like Dr. Mary Claire Haver, Dr. Vonda Wright, Dr. Kelly Casperson, Dr. Louise Newson. All female doctors who began to have their own menopause symptoms or perimenopause symptoms and kind of went, what the heck? What is this?
Yeah.
And who really acknowledged that at medical school they haven't been taught very much about it. And I think you really probably have the collision of that. So a lot of female doctors maturing and also social media and access to information. So to be honest, there's patients out there who are way more educated than their doctors. And that can be so frustrating for a patient. And I often see women who, you know, I'm maybe doctor number 5 by the time they've done the rounds, and they're kind of at the end of their tether.
And you do, because I have a male doctor, and I do think when I talk to him about this, you can't possibly understand what I'm going through, and I just wonder if I'm being, and he's very good, but I just wonder if I'm being prescribed whatever everybody else was who's showing similar symptoms to me and similar blood test results. And that scares me. And look, I have to ask you one question, because I know we can't have you for too long, and I've got so many questions, and I'm hoping that we can continue this on if you don't mind.
Of course.
But one of my girlfriends said, and she's going through something, she lives up in Brisbane and she's a fan of yours also. She said, could you please talk about the benefits of testosterone? Australia and New Zealand are the only countries in the world that supply women with a woman's dose. And she said that's pretty forward thinking. Can you touch on that quickly? And I know we want to come back to this, but this was a question for my friend Katrina who's listening.
So testosterone is definitely something that suddenly everyone's talking about. And so we are really lucky in Australia. We have a product, comes in a little white and pink tube just to reinforce it is for women. And it is licensed in Australia to be used for a thing called hypoactive sexual desire, which basically is low libido in women, and it can be very helpful.
Katrina's going to be really glad I called her name out now.
But again, something that we should be talking about, how healthy sex life is something that you should be proud of.
Well, Maddie, as you said, you know, men have been being prescribed these little blue pills for a long time, and as doctors, we've been very sympathetic to men who have low libido or erectile dysfunction. But, you know, without being too graphic, what are all these men going to do with their newly lease of life if we don't help their partners as well?
100%.
So, yeah, I think it's definitely a conversation. And we also have to move away from thinking of estrogen as a woman's hormone and testosterone is a male hormone. It's absolutely not true. So if you have the average couple and they're sitting there and let's say they're both 53 and she's postmenopausal and not on hormones, her husband has more estrogen than she does.
Oh, really?
So, you know, men have estrogen. Women have testosterone.
Yeah.
We have to stop thinking about these as sex hormones and we have to think about them as whole body hormones because they're impacting every cell in your body.
Dr. Shauna Watts, fascinating. I could sit here and listen to you talk about this all day because I'm absolutely getting schooled right now. Gina mentioned your podcast. You want to give that a plug? If someone's listening at the moment going, I want to hear more of Dr. Shauna, where do we follow? Obviously, wherever you get your potties, but...
Yeah, so the podcast's called All About You with Dr. Shauna Watts. And it's not just menopause, but there is a lot of perimenopause, menopause content on there with some of the most famous doctors that you'll hear talk about this specialty. officially. So yeah, it's on YouTube and on Spotify, Apple, wherever you get your podcasts. And we'd love your support.
And you're based here on the coast as well.
I am,
Yeah.
so it's pretty nice. And we've had some pretty famous people on there, so it's pretty cool for the Central Coast.
Gina's already put you on the spot twice. She did mention it during the chat. Would you come back if we can work out a time where you come back and we can explore further on this?
I would absolutely love to. The more we get this out there and the more women that we can help.
Yeah.
And to be honest, it's not just helping women because it's helping their partners, their families
Yeah.
as well. And it's helping, people thrive in life. So I'm absolutely all here for this.
We'll
No,
catch you
thank
next time.
you.
Thank you very much, Dr. Shauna Watts.
You're welcome.
Listen to Gina and Maddie weekday mornings from 5:30.
Live on the Star Player.